Hi, Professor. Okay, this is my exam for 306. This is my mother, by the way.
Hello.
I just want to show you how I'm going to be setting it up. This is the room. You know, there's no issues, no cheating, no nothing on the wall. Here is my blood pressure machine, my oculator, I have my pen light over here with me. And I have also, like, you know, my fake ophthalmoscope, my otoscope, my cotton ball, my little speculums. And here's my little setup that I have over here. So I'm gonna just put it on. This looks good. All right, so we're about to start.
Yes?
Hi, can I come in?
Sure.
Awesome. Hi, I'm Emilio Jimenez, and I'm going to be your nurse today. So today we're going to do a physical assessment. So we're going to do an assessment of your face, of your eyes, your ears, your mouth, your throat, and your neck. So today we're going to be collecting data, and then all the data is going to be documented in the EHR. Only your physicians and your providers are going to be able to see any of the information. So it's all going to be confidential, and everything's going to be private. I just also want to remind you that if you ever want to request it, you can, and it will be accessible for you.
Okay.
Awesome, right? This room is private. No one's going to be coming in. Do you feel safe and secure in this room?
Yeah, sure.
Are you comfortable?
I'm very comfortable.
All right, awesome. So we're about to start the assessment. I'm going to go wash my hands.
Okay, good.
Do you have any questions by any chance of the assessment?
No, not at all.
All right. So the first thing that we're going to start with is vitals. So we're going to do first blood pressure, and we're also going to do pulse. So I'm going to take my little blood pressure machine here, and I'm going to start with my pulse. Okay? Do you mind if I have your hand? Oh, awesome.
No problem.
All right. Whoa. Awesome. So your pulse was 66 beats per minute.
Okay.
And also that your respirations was 14 breaths per minute. Okay? So everything is within normal limits, great heart and great respiration. So now we're going to actually move to the blood pressure. Do you mind if I have your arm?
No.
Awesome. Please tell me if you have any pain, any discomfort. Sorry, let me just. And what are your baselines, by the way?
120/65.
120/65. Perfect. All right. right, I had 125/75.
Okay.
That's good. Very good. You have very healthy blood pressure.
Okay.
All right, so now we're gonna proceed to the face. We won't need any equipment for the face. I'm just gonna be really assessing and inspecting your symmetry and also cranial nerve number 7. So first I'm gonna do symmetry. I could tell by your eyes that your eyes are perfectly symmetrical. I can see that your face is symmetrical. So I could see that your lips are symmetrical, that your nose is midline, your eyebrows are even. I don't see any acne or any irritation. I do have some question about your past history. So do you have any history of swelling? No swelling?
No.
All right. Any history of acne?
Yes. When I was a teenager, it was pretty bad.
Really?
Breakup. Yeah.
I mean, also like the older that we get, less hormones, less acne,
Okay.
And also, do you have any history of pain?
No.
No pain on your face?
No.
Okay,
No.
perfect. So now I'm gonna ask you, we're gonna do a test for cranial nerve number 7.
Okay.
Okay, so I'm gonna ask you to squint. Squint. Can you frown? Perfect. Can you smile? Perfect. So I tested cranial nerve number 7. It shows that your face is well innervated. So that means that you have good control of your muscles on your face. So for Professor, all your outcomes were very healthy. You have good symmetry, and on top of that too, your cranial nerves are well innervated. So some of the outcomes for the older adults, or usually the objective findings, are more wrinkles, more subcutaneous fat. So that means that they kind of have more droopier eyelids, droopier eyes. They usually have like kind of coarse hair and less eyebrows. All right. So now we're actually going to move to the eye exam. Okay. So I just have some questions regarding. Well, first, actually, for the eye exam, I need to explain the equipment that we're going to be using. So we're going to use my trusty pen light, my ophthalmoscope, the occluder, and our Snellen chart, which is down there. Okay. So first, we're going to do. I'm going to actually inspect your eyes. I can look at your eyes right now. So I'm looking at your eyebrows. I see that they're symmetrical, which is normal. I'm looking at your eyes and I see they're symmetric too. I'm looking at your eyelashes are coming out and curved out, which means they're normal as well. I'm looking at your at the shape. Everything is normal. Your fissures look normal. Can you please close your eyes for me? Perfect. Can you open them back up? Okay, so your eyes approximated perfectly, which means that they close. The top part closes with the bottom perfectly, and your palpebral fissures are normal. They're horizontal, not slanted by any means. I do have to check your face. Do you mind if I can touch your face by any chance? I'm going to be checking the conjunctiva and the sclera. Okay. So when I touch your conjunctiva, when I touch to look for your conjunctiva, when I pull up, look down, and to look up when I'm pulling down. Okay. All right. So now look down. Perfect. Now look up. Perfect. So I saw that your sclera is a nice white china color. It's well moistured. So it's moistened. It has that nice vascularity for the eyes. Also that it has that your conjunctiva is clear, meaning that the top part is going to be white. So it was white, and the bottom also showed as pink because there's a lot more vascularity there. So your eyes looked perfect and normal. Now we're going to move to Perla test. So the Perla is going to be checking that the pupils are equal, round, react to light, and they accommodate. Okay. So I'm going to be using my pen light, and I'm going to be coming to you at a 30-degree angle. Right now I'm going to look if your pupils are equal and round. So looking at you, I can tell, yep, they're equal and round. Okay, now we have to check react for light. We're looking for direct and indirect light. Okay, so this is going to be looking for direct is going to be when it hits, it's going to be constricting, and then indirect is going to be consensual. So that means that the other eye is going to be constricting when the other one is doing it. So I'm going to be coming from the side. Perfect. Coming from this side. Perfect. Now I'm going to be looking for indirect. Now I'm looking for indirect over here. Perfect. Keep straight. Alright, awesome. Now I'm going to be looking for accommodation. Well, first actually I'm going to do the corneal light reflex. So look straight at me. Alright, and I'm going to hit in the center of your face, right here. Perfect. So I see the 2 white dots, which means that there's no like lazy eye, and that kind of like your eyes are centered and parallel. Now I'm going to be looking for accommodation. So that means look straight at my pen, and I'm going to come closer to you. Do you mind if I come closer?
No.
Alright. It's your eyes. Perfect. Okay, perfect. So your eyes accommodated, which means that your pupils constricted and they converge. Okay. So now I'm going to be looking at the extraocular muscle test. Okay. So right now from the perla, your eyes were perla, so they had pupils that are equal, round. They react to light and they accommodated. So we're looking here for, I want you to not move your head, and we're going to be moving parallel to your eyes are going to move parallel to my pen, and we're going to hit the 6 cardinal directions, okay?
Okay.
And we're always going to meet in the middle, okay?
Okay.
Ready? Middle. Okay, perfect. So looking at your eyes, they had no nystagmus. They also were parallel, so that means that you didn't have any issues. There was no twitching when I did your test. Okay, awesome. Now we're gonna do the Snellen chart test. So we're gonna be checking for your visual acuity, also cranial nerve 2. The last one we checked was cranial 3, 4, and 6 when we did the cardinal test.
Okay.
All right. So occlude only one eye and don't put any pressure on it, okay?
Okay.
And you're gonna read for me the lowest eye number that you can see with that eye.
P X Y R A Z W.
Okay. Can you go any lower?
Sure. Z P L Q R S T I.
Perfect. So that means that, can you do it with the other eye?
Sure.
Okay.
P R K Z W T O I.
Can you go do anyone a little bit lower?
R S Q P L J K T.
Perfect. So that means that you had 20/20 vision. You could see 20 feet away from 20.
My job depends on that.
I know, as a computer
programmer, that's what I needed to hear.
So now I'm going to be doing the, I'm going to check actually the inside of your eyes, your retinal vessels, your fundus of your eyes. I'm going to be checking for the red light reflex, and I'm going to do this with my trusty ophthalmoscope right here, okay? So I'm going to do left hand, left eye, left side, okay? So we'll be facing, I want you to look directly so your eyes dilate. Okay, keep looking. Look at that little spot over there. Okay, continue. Alright, and now I'm going to be coming around 10 inches away from you. And now that I'm going to come closer, I'm going to put, so the light is on. I can see right now from these 10 inches. I'm going to come closer. Do you mind if I do?
No, I don't.
Alright, so I can see the red light reflex right now. And now that I'm coming closer, I increase the diopter. I see your physiological cusp. I see the retinal vessels. I see the 4 to 6 ratios. I see the fact. I see the macula. I see the vessels have no nicking. I see how dark and nice the macula is. I see how the physiological cup is larger, and I see the creamy color in the back of it and the fundus too. Alright, super healthy.
Good.
Alright, now we're gonna do the other side. Alright, so from far away I have my light on. Okay. And now I see the light reflex. Keep looking at that spot over there. Alright, now I'm going to be coming closer, increasing the diopter by 6. Again. And I see the same thing, no nicking. I see regular vessels, 4 to 6. I see your red arteries. I see the physiological cusp, the black macula, and good disc ratio from the optic disc to the macula. Alright. Perfect.
Good to hear.
So some of the findings for the older, everything, just to summarize everything that has happened, you have perfect eye vision, you have 20/20, your macula, your fundus, the back of your eyes, your retinas are perfect, no nicking. There was no issue with your physiological cusp, oval, perfect size, perfect shape. Everything, the outside of your eyes look good, everything looks good. Now going to the older adults, they're more likely to have presbyopia, which means that they have loss of vision. On top of that too, older adults are more likely to have greater constriction in their eyes, and also to have more orbital fat around their eyes, so they looks like almost drooping around their eyes. Okay. No offense to you. So now I'm gonna do the mouth.
Okay.
So the mouth, we're gonna be. So I have some questions just regarding with your mouth and throat. Do you have any troubles swallowing?
Not
Not
at all.
at all.
Not at all.
Okay. Do you have any lesions in your mouth?
No.
All right. Do you have any pain in your mouth or throat? Okay. Any discharge or infections?
No.
Okay. Perfect. No ulcers or anything, right?
No ulcers.
Perfect. So the items that I'm going to be using for the mouth is going to be the pen blade that I have over here, or we're supposed to use a pen blade somewhere here. So I have my trusty pen blade, and also my pen light, which is over here. Okay. So for the mouth, I'm looking at the outside. I see it's symmetrical. I see that they approximate, so that means that they're closed and they're comfortable. You have great moisture to your mouth. Do you mind if you open your mouth for me? Okay, so right here I'm checking for your mucous membranes. I see that they're pink and nice, no lesions, no cuts. I can see your Wharton's duct, which is down here, which is connected to the submandibular gland, and I see your Stenson's duct, which is up here, which is to the second upper molar and attached to your parotid glands. I see that your mucus is fine. I don't see any lesions. Can you take out your tongue for me? Perfect. I see that your tongue has an adequate amount of saliva. I see that it has also, it's smooth and even. And your mucous membranes are nice and healthy. I don't see any cuts on the outside or the inside of your mouth. Awesome. Can you stick out your tongue and say, ah? Perfect. Okay, so testing that, I checked that your vagus, your 10th nerve, your cranial nerve. So your uvula went up on midline. Also, can you do it one more time to see? Go open your mouth. I don't see your tonsils.
Yeah,
You had a tonsillectomy?
Yeah.
Okay.
When I was 15.
Alright. So the normal results would be between a +1 or +2. You don't have tonsils, so we can't do that. Which is fine. It happens to people. Yep. And can you take out your tongue and move it side to side for me? Alright. So that's checking cranial nerve 12. Okay. So that's also intact. So some of the older, the results for the older adults is that they have xerostomia, which means that they have a dry mouth. Older adults are also more likely to have like less teeth, and also they're more likely to have gum issues too. Yeah. And can I see your teeth for a second? Perfect. So I see that your teeth are even, white, you know, no
No.
decays. Yeah, that they're.
I have all my teeth.
Oh, your teeth are there.
Yeah.
Perfect. Thank God.
Thank God.
All right. So yep. So that was the objective findings for the mouth. Okay. And I already said. Okay. So now we're moving to the nose. Okay. So the equipment that I'm going to use for the nose is the speculum. So the speculum is going to be, the otoscope with the speculum. I'm going to be testing for cranial nerve 1, and I'm also going to be checking patency and just the inside structures of your nose. So can you please occlude one nostril for me? And breathe in. Breathe in. Only in. Okay. And the other one? And breathe in. Perfect. Also with your nose, I forgot to ask you questions, but so do you have any epitaxis, so bleeding in your nose? Any?
No bleeding.
No bleeding. Any discharge?
No discharge.
Any allergies?
No, I don't suffer any allergies.
No allergies. Perfect.
No
Okay.
allergies.
So for your nose, also I'm gonna use my speculum. So my otoscope with the speculum. So I'm gonna put it 2 to 3 centimeters in. Do you mind if I put it in?
No, not at all.
All right. So right here, I'm checking the inferior and superior turbinates. Inferior and middle turbinates, not the superior. And I don't see any discharge, no polyps, no. I don't see any blockage, no deviated septum, no polyps, no nodules, and no inflammation, which is very normal. And your mucous membranes are red, which is very good. Now I'm going to do the test, checking for cranial nerve number 1. This test is going to be for the smell. So do you mind if you can smell this for me with the cotton ball?
It's like mint.
Like mint? Perfect. So you have good sense of nose and good sense of smell. Now I'm going to be checking your maxillary and frontal sinuses. They shouldn't be hurting at all or inflamed. Do you ever have swelling in your sinuses?
No, not at all.
Not at all? All right, so no swelling, right?
No.
Do you mind if I touch your sinuses?
No, I don't mind.
All right. Perfect. Any pain?
No.
All right. This is your maxillary. Any pain?
No pain at all.
Perfect. Okay, so there's no swelling, no pain. That's completely normal. So everything came out normal. You have great sense of smell. You have no swelling or pain in your maxillary or frontal sinuses, and you didn't have any nodules or a deviated septum or any issues with your nose at all. No swelling, and like your history showing, right?
Okay.
So now we're gonna be moving to the ears. Oh, sorry. Before that, some of the expected finding for the nose is a larger nose for older adults. Also for older adults, they have a less sense of smell too. Yeah.
Oh my God.
And more usual. They have also more hair in their nose too. Larger nose, more fat. Okay.
No problem.
So now I'm going to be moving to the ears. I'm going to be using an otoscope and also my my tuning forks. So we're going to be checking your sense of hearing too. So for the ears, do you have any history of loss of hearing?
No.
Any environmental hazards, like you live in a loud neighborhood or
No.
No? Perfect. Do you have any discharge or infections in your ears?
Never. No.
Perfect. Okay. So now I'm gonna check your ears by the outside. Do you mind if I touch your ears?
Not at all.
Okay. Tell me if any part hurts. Okay. Okay. No pain.
No pain. No.
Perfect. So we don't have any pain in your ears. I'm gonna look at your external canal right here, the auditory canal. Your external auditory medius right here. It's perfect circle, no inflammation, no red swelling. It's not tender, no inflammation, no excessive cerumen. I don't see any polyps or nodules on the outside. So that's good. Now I'm actually going to do a whisper test for you. So I'm gonna be standing 2 feet away from you, and I'm only gonna say like 3 random words or numbers, and I just want you to repeat it for me, okay?
Okay.
Okay. So I'm 2 feet away, so it's sorry.
854.
Perfect.
Y64.
Yep. Perfect. So you heard from both sides, which is perfect. Now I'm going to be checking with my otoscope. I'm going to be coming upside down, and I'm going to be pulling the pin up and back, and I'm going to check the inside in your tympanic membrane and look for the light reflex with my otoscope. Alright. So I'm going to pull it up and back, and I'm looking in the canal, and I'm looking for swelling, discharge, blocking. And this is the right side, so on the right side I see at 5 o'clock the light reflex there in your ear, and I see that your tympanic membrane is a nice gray dull color. Everything's intact. I see that there's no swelling, no polyps, no nodules, nothing is blocking, no discharge. And now I'm going to be going on the other side. First, I'm going to clean my otoscope too, and the speculum of my otoscope. It's not to transfer anything to the other ear. And do you mind if I pull the pin? So I'm going to pull the pin up and back. Alright, I'm checking the otoscope, and at, this is the left ear, so at 7 o'clock I'm checking if there's the light reflex, which I do see. And I didn't see any excessive cerumen. I saw a good amount, but not excessive. I saw that your tympanic membrane had the light reflex at 7 o'clock. The other one had it at 5 o'clock. I saw that it had the right color, completely intact, gray, dull color. So, and it was that nice gray dull color. Yep, no issues with your ears that I saw visually. Now we're going to be moving to the tuning fork test. Okay, so I'm going to be so this is my tuning fork, and this is the, actually this is my otoscope. This is my tuning fork, and we're going to be, this is the top part of my tuning fork and the bottom part of my tuning fork. And I'm going to slap down on my tuning fork, and you're going to tell me when you hear it and when you don't hear it, okay?
Alright.
Okay?
Okay.
So my tuning fork, I'm going to slap, and this is looking for bone conduction and air conduction. So first I'm going to do the bone. Tell me when you don't hear it.
I don't hear it now.
Do you hear it?
No. Yes, I do. Yeah, I do.
Okay, perfect.
Yes.
All right. And tell me when you don't hear it.
Now stop.
Do you hear it?
Yes.
Perfect. So that means that your air conduction is greater than your bone conduction, which is how it should be. Now I'm going to do it on the top of your head, and you should tell me if you hear it on both sides or if you don't.
Okay.
Do you hear it?
Yes, I do.
Okay, perfect. On both sides?
Yes.
Perfect. You have great hearing then. Okay. So, alright, so now we're done with the hearing test. You have perfect hearing, both sides, no issues with your tympanic membrane or the outside. There was no sensitivity, no pain, greater air conduction and bone conduction, which is all normal, everything within normal limits. And your membranes in your membrane inside your in the cilia in your ear seemed perfect. Everything looked good. And now for the older adults, a common finding is presbycusis. On top of that, also greater cerumen in your ear, so greater earwax.
Okay.
And also larger lobules in their ears, so they have this part kind of bigger. Yeah. So now we're going to be moving to the last part of the exam, which is going to be the neck. Okay. So do you have any stiffness of your neck?
No.
No?
No.
Any issues with range of motion?
No.
Any swelling or?
No.
No?
Mm-mm.
Okay. Any nodules in your neck or?
In the past, yeah.
In the past?
Because, but everything is good.
Okay.
I got some, my
Tonsils removed?
thyroid.
Oh, your thyroid removed?
Yeah, removed.
Okay.
But nothing bad.
Okay.
After that, it's been over 11 years with no issues. So
No issues. So you don't have thyroid, right?
No, I have no thyroid.
Okay.
Since 2008.
Okay. All right. So now we're gonna move to your exam, and we're gonna be doing the you check your nodules.
Okay.
All right. So no issues then with your neck. So we wouldn't be able to feel your thyroid at all, but we're only gonna be checking your nodules.
Okay.
Okay. So in your, I mean, not your nodules, your lymph nodes. Sorry, not well, they're nodules, but lymph nodes. All right. So. Tell me if it hurts. They shouldn't have any pain at all, and they shouldn't be swollen at all. Okay.
All
Alright. No pain and no swelling, and they shouldn't be really palpable. So this is your preauricular lymph node. No pain. Posterior auricular lymph node.
No pain.
This is your occipital lymph node.
No pain.
Alright. This is your submental lymph node.
No pain at
No
all.
pain? Okay. This is your submandibular lymph node.
No pain at all.
Okay. Your jugular-digastric lymph node.
No pain at all.
Okay. This is your superficial cervical lymph node.
No pain at all.
And this is going to be your deep cervical chain lymph node.
No pain at all. Good.
Okay, good. They feel given.
Yeah.
I don't see any swelling. And then this is your posterior cervical lymph node.
No pain.
No pain? Okay.
No pain.
And do you mind putting your shoulders up? This is checking cranial nerve 11, and also I have to check your supraclavicle.
Like that?
Yes, perfect.
Okay.
Supraclavicle, supraclavicular lymph node. Perfect. So there was no tenderness, there was no pain,
No pain.
and none of them. Great.
Okay.
All right. So so that ends with the neck, and so just ending with this. So for the older adults, you have no issues with your lymph nodes at all. But for the older adults, a common finding is higher increase of apnea and also greater neck fat actually. So also that they have more likeliness for stiffness of neck and less range of motion. All right, so that ends our assessment. I'm just gonna let you know that everything came out completely normal.
Thank you so much. Thank you, doctor.
I know, but no, nurse.
I mean, nurse, I'm sorry.
No, everything came out completely normal. So I'm gonna document everything. So just to summarize all your assessments, your eyes were 20/20. You had perla, which means that you had people that equal react to light and accommodate. You have your macula and your physiological optic cup was right. You don't have any issues with your face at all. The only thing that you had were obviously your thyroid and your tonsils removed. So we weren't able to find your tonsils. In your mouth there were no lesions. Everything was even, perfect. Everything was normal. And even your mouth, your neck, everything, your lymph nodes are not swollen, your tonsils were good, your eyes and your ears, everything was perfect.
Oh, thank you so much. Thank you very much.
I'm gonna document this right now, and I'm gonna perform hand hygiene, okay?
Okay, thank you. Thank you for your time.
No, thank you.
So much.
All right, and we're finished. You can
Okay, thank you. Bye. Bye-bye. Thank you.